Welcome to MedAxiom Heart Talk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom Heart Talk starts now.
Welcome. My name is Joel Sauer. I'm the Executive Vice President for Consulting with MedAxiom, and I'm joined here today by Kootenai Health. And I have Rhonda Powell and Dr. Kavanaugh, who are the dyad leadership for the cardiovascular service line. And we recently completed an assessment of your service line and a strategic planning process, and would love to hear your insights into that project, both from a motivation, what brought us there, why did you want to endeavor on that, to the process and the conclusion.
We're a private group for decades, and were acquired in 2012. Prior to that, we were MedAxiom acolytes. We had dyad partnership before dyad partnership was cool. And in 2012, when we were acquired by our institution, we were pretty much left alone to run the outpatient program, but the inpatient program, supervising by our dyad partnership, was mostly by agreement. There wasn't really anything on paper. And as time went on, that slipped away with both leadership retirements and transitions, to where our involvement in the inpatient realm was becoming less and less, and was becoming more and more problematic, and we saw it as an issue. And we went to our administration to try to rectify that, and at that point engaged MedAxiom to help us with that, both programmatically and contractually. And you guys are great. You spent a lot of time interviewing all the stakeholders, both administrators and providers, helped us with a program, clinical councils, dyad leadership, and really helped to codify what we were looking for all along. And it worked out very well. We've been very pleased with the results, and as has our administration.
Yeah. Rhonda, from an administrative standpoint, the silos where we manage the inpatient side as if it's completely separate and distinct from the ambulatory, which it's not. How did that manifest in your world from an administrative standpoint?
I think, in the past budget, everything was completely siloed, completely separate, and it was really hard to know what each side of the street was doing. This has brought it all together. I'm not going to say it's been completely harmonious, but it has brought it all together and gives me a much bigger strategic outlook and the ability to plan ahead. And, the Cardiovascular Institute model is the first for our facility, and it's really nice to have your partnership and help guide us through that.
Well, we appreciate the kind words, certainly. I know it's early from the standpoint of having tangible results, but what are the early returns after this? Have they been positive?
No, very much so. Yeah.
Okay.
Yeah. In fact, the institution, I think, will probably extend this model to other service lines.
Well, that's
neuro-ortho,
Oncology.
So that's an endorsement right
Yes.
there. Yeah.
Yes.
Okay. Excellent. Why don't you describe what were the most significant changes from before and after that you made in terms of connecting those dots?
I think by far and away it's Rhonda's role now as a supervisory role over the entire service line, whereas before it was much more siloed. So we're able to have insight into the financial aspects. One specific example might be PFA, to bring that online.
Okay.
There was a lot of pushback from administration initially because of cost, and when we could bring up the pro forma and all the things, all the advantage it would bring to us, I think that was very helpful.
So your authority basically went from just one-sided to now you had the entire care continuum.
Correct.
Operational continuum.
Yes, and in the past, the capital budget especially was very siloed, and to be able to bring the physicians to the table and be able to explain why we need something has been incredibly beneficial to get things through the process.
Excellent. Any words of wisdom that you would extend to your peers in the MedAxiom community who may be either endeavoring on this or exploring it as a opportunity?
Well, I think one thing is use MedAxiom as a resource. You guys were excellent. Both ideas that we wouldn't have thought of, but also to really help our administration know that this is best practice for a service line like ours, and to reassure them that they're not proceeding down some
Crazy rabbit hole?
Yes, correct. Yes.
Well, we like to say cardiology is special or cardiovascular is special, but it really kind of is. It's unique in many aspects. What were the biggest challenges? What were the biggest barriers to making this happen?
I think deciding what was included in our cardiovascular institute structure. We ended up bringing pulmonary medicine over with us, and I think that could have gone either way. And I think looking to MedAxiom for the resources and the models that are out there was very helpful in including pulmonary in our model.
Yeah.
And that's a good point too. It solidified our structure. We're over the vascular surgeon and the cardiovascular surgeons as well. And to help solidify that structure was very helpful.
Yeah. It also demonstrates that this isn't a cookie cutter. You don't just pick it up exactly as it was done in Des Moines and bring that to...
Correct.
Right.
Yeah. You have to tailor it to the specific circumstances and culture of your program.
Very much so.
Well, thank you very much. This was very beneficial for us, and thank you for the kind words. We always appreciate that as well.
Thank you for your support.
Yeah, we appreciate everything you did for us.